Hello, students. In this episode, we will learn vocabulary about patient care procedures. Please review this episode several times to ensure you know the vocabulary well. Module 9, Patient Care Procedures. Statement of purpose. The purpose of this unit is to provide learning experiences that will prepare the nurse assistant to safely carry out procedures that support the patient/resident in meeting physical care needs that cannot be performed independently. Performance standards, objectives define key terminology. 1. Admission. 2. Anti-embolic stockings. 3. Bandage. 4. Binders. 5. Clean catch. 6. Defecate. 7. Discharge. 8. Draw sheet. 9. Edema. 10. Elastic bandage. 11. Electric bed. 12. Evacuation. 13. Excoriated. 14. Expectorate. 15. Fan fold. 16. Fluid. 17. Gastrostomy tube. 18. Hives. 19. Intake. 20. Integumentary system. 21. Intravenous, 4. 22. Lesions. 23. Manual bed. 24. Mitered corner. 25. Mucus. 26. Nasogastric tube, NGT. 27. Non-prescription. 28. Occupied bed. 29. Ointment. 30. Output. 31. Percutaneous endoscopic gastrostomy, PEG. 32. Pruritus. 33. Reflux. 34. Reverse Trendelenburg. 35. Scaly. 36. Semifowler's position. 37. Side rails. 38. Specimen. 39. Suppository. 40. Transfer. 41. Trendelenburg. 42. Unoccupied bed. Patient, resident, and client are synonymous terms referring to the person receiving care. CNA Vocabulary Practice Sentences, Module 9, Patient Care Procedures. Vocabulary sentences for adult English learners. The nurse completed the admission process when Mrs. Johnson entered the nursing home for long-term care. The CNA applied anti-embolic stockings to the patient's legs to prevent blood clots from forming during bed rest. The nurse assistant used a sterile bandage to cover the wound on the resident's arm after cleaning it. The physical therapist used abdominal binders to provide extra support for the patient's back injury. The CNA collected a clean catch urine sample by having the patient urinate into a sterile container. The resident needed assistance to defecate because of mobility problems and constipation. The family celebrated when the doctor signed the discharge papers, allowing their father to return home. The CNA used a draw sheet to help turn the patient in bed without causing skin damage. The patient's ankles showed edema, with visible swelling from excess fluid buildup. The nurse wrapped an elastic bandage around the resident's sprained wrist to provide support and reduce swelling. The CNA raised the head of the electric bed by pressing a button to help the resident breathe more easily. During the fire drill, staff practiced evacuation procedures to safely move all residents out of the building. The patient's skin became excoriated from lying in the same position too long without being turned. The respiratory therapist taught the patient how to expectorate mucus effectively during breathing treatments. The CNA used the fanfold method to fold the clean sheets for quick and neat bed making. The doctor ordered the patient to increase fluid intake to prevent dehydration. The resident received liquid nutrition through a gastrostomy tube because he could not swallow safely. The patient developed hives on her arms after taking the new medication, indicating an allergic reaction. The CNA recorded the patient's daily intake by measuring all liquids consumed during meals and snacks. The integumentary system includes the skin, hair, and nails, which protect the body from infection. The patient received medications and fluids through an intravenous, line in his arm. The doctor examined the unusual lesions on the patient's skin to determine if they needed treatment. The CNA used the hand crank to adjust the manual bed to a more comfortable position for the resident. The nursing student learned to make a mitered corner when changing bed sheets to keep them neat and secure. The patient coughed up mucus from her lungs during the respiratory infection. The doctor inserted a nasogastric tube, NGT, through the patient's nose to provide nutrition directly to the stomach. The resident could buy non-prescription pain relievers like aspirin without a doctor's order. The CNA carefully changed the linens on the occupied bed while the patient remained lying down. The nurse applied antibiotic ointment to the small cut on the resident's finger. The CNA measured the patient's output by recording the amount of urine collected in 24 hours. The surgeon placed a percutaneous endoscopic gastrostomy (PEG) tube for long-term feeding in the unconscious patient. The resident complained of pruritus and kept scratching the itchy rash on his arms. The patient experienced reflux when stomach acid came back up into the esophagus after eating. The surgeon positioned the patient in reverse Trendelenburg with the feet elevated higher than the head during the procedure. The elderly resident had scaly skin that was dry and flaking, requiring daily moisturizer application. The CNA positioned the patient in semi-Fowler's position by raising the head of the bed to help with breathing. The nurse raised the bedside rails to prevent the confused patient from falling out of bed. The CNA collected a urine specimen in a sterile container for laboratory testing. The nurse inserted a suppository into the patient's rectum to help relieve constipation. The ambulance crew prepared to transfer the patient from the hospital to the rehabilitation center. The surgical team placed the patient in Trendelenburg position with the head lower than the feet during the operation. The housekeeping staff cleaned and made the unoccupied bed with fresh linens for the next patient.